I'm a graduate teaching assistant and a member of the union. And the reason that I wanted to speak was we're currently negotiating our first contract. And one of the issues that has been particularly relevant to myself and a lot of TAs is the healthcare provided as the student health insurance. So I just wanted to share some of the struggles that I've had accessing healthcare as graduate teaching assistant since I started this fall. Due to COVID-19, I'm currently living out of state in Wisconsin. And while I'm glad that the opportunity was made to do schooling online due to the pandemic, it has created some challenges with me accessing care using my student health coverage. In order to educate myself on how to get mental health services, I attended a training planned by the Student Counseling Center. I was really excited and pleased by all the amazing options and the free therapy appointments that my student fees pay for. However, when I called, I was directed to the director of the clinic and was informed that because I live out of state, I'm not eligible to access any of those services. And my only option would be to look for a local provider. When I contacted the student health insurance, I found out there was a huge shortage of providers that are covered in my area and providers in general. There's not a single psychiatrist within an hour of where I'm living right now in Wisconsin who's in network and taking new patients, which means my only other option would be to go across state lines to Minnesota. So this has created a lack of care that has been very challenging. Another issue I ran into was filling my mental health prescriptions. I didn't realize how the reimbursement plan that is offered by ISU works. And what that means is that basically we pay full price out of pocket and send our receipts in for 80% compensation. When I realized that my 90-day supply of generic medication was going to cost me over $2,000 out of pocket every 3 months, I was pretty horrified. And even if I get the full 80% reimbursement, it costs $400 4 times a year. Considering that I only make $857 per month, that means I'm spending about 2 months' salary just on medication, and that's before considering therapy, regular doctor's appointment, dentists, or anything like that. And each of those therapy appointments, even in network, is over $50. When I called ISU, the student health insurance, they told me that until I hit the out-of-pocket maximum, that there's not any other options. And thankfully, I was very lucky to have a family friend who's a pharmacist who informed me of a coupon program called GoodRx. And luckily, my particular medications are discounted significantly through that program. Unfortunately, that's not the case for a lot of medications and for a lot of students. My medication was discounted enough to make it affordable to me once I get my refund from the ISU student health insurance. And I also have a partner who works full-time and helps with the financial support while I'm in school. The problem is that there's so many GTAs who don't have a partner to help them, and so many GTAs whose medications are also not discounted through other options like GoodRx, and who would be stuck paying the maximum rate. I know many insulin prescriptions are over $500 per month, even with GoodRx. So if you consider that those students would only get 80% back and have to pay upfront, that's an awful lot coming out of a pocket that only makes $857 a month. Even after calling student health services, I wasn't provided with any information about the GoodRx program, and I was really lucky to have a friend I could go to. Given that the prescription program with our student health insurance is a rebate program, it seems wild to me that this wasn't even mentioned as an option to help with the upfront costs. As grateful as I am to have a position as a GTA, there's a huge problem with the health insurance that we pay for. It doesn't provide nearly enough coverage for people with ongoing health issues and medication needs. And with our current salaries, and due to the fact that many of us are living in different circumstances than is typical due to the COVID-19 pandemic, it has been really challenging to access care for myself, and I know for many fellow GTAs. My student fees also that I pay each semester don't actually help me get the care that they're supposed to because of my current living circumstances. And we also have no dental insurance. So on top of all of the prescriptions and the doctor's appointments that I'm paying for, I additionally pay $35 a month just to get basic dental coverage for myself. At the end of the day, as much as I love being a GTA, it seems like we should be able to afford our healthcare without growing broke or having to rely on a partner's income to keep us above water. My story is just one that explains why we are working so hard towards negotiating our first contract with ISU. Thank you.
All right, thank you, Ms. Gibson. And Alex Morales is next.
Hello, my name is Alex Morales, and I am a graduate worker and a member of the Graduate Workers Union. On Thursday, January 14th, the union delivered a stern message to university negotiators about the stagnant state of bargaining. I will read that message to you now. We in the ISU Graduate Workers Union have talked about the state of bargaining extensively among ourselves and what revisions or counter proposals we might make to respond to the university. However, ISU's proposals at this point are essentially no offers at all, status quo wrapped up like something new. Graduate teaching assistants did not volunteer many long and stressful hours forming a union, preparing and engaging in good faith negotiations in order to merely approve changes or policies that the university has already made. Offering previously announced changes or policies is not negotiating at all. We do not believe that we are making progress or that ISU respects our time or the urgency of our situation. Since we began negotiations on October 31st, 2019, ISU has consistently stalled even as a global pandemic emerged and endangered our already endangered GTAs. A major example, ISU took over a year to respond to our initial offer. Over these 14 months, we have repeatedly tried to explain the dire situation that many GTAs are in. Due to the low stipends, many GTAs experience economic insecurity, which leads to insecurities in other areas like housing, food, and healthcare. Some GTAs receive no pay at the end of the month after their fees are deducted. Others accrue substantial debt, losing money from coming to work at ISU. In the face of this urgent need, ISU offers small raises in accordance with state minimum wage law that will only affect a small percentage of our members and do little to ease the everyday danger that our GTAs experience. In fact, we believe that ISU wants us to negotiate against ourselves, which we have no interest in. As a result, we have nothing further for ISU at this time, and we believe that it is fruitless to meet further until we have a mediator present. The insecurity and danger our members experience is too urgent an issue to waste time with ISU's non-offers. We are not going to willingly continue to put ourselves in this position when ISU has disrespected us time and time again. We are not refusing to negotiate, rather refusing to pretend that ISU is negotiating with us. If ISU has something to offer us that actually addresses the severe crises that TAs face, that ISU itself creates with low stipends, poor benefits, and high fees, we are ready and we are willing to hear it. But until that time, we have nothing for ISU except the notice that we request that the Labor Board impose mediation at this time. Last Friday, a delegation of the unionized grads served the mediation paperwork on Labor and Employment Relations Director Mike Kruger, the university's chief negotiator. And to the academic senate, we would like you to recognize that we deserve at least a living wage. We ask that you advocate for us to ISU's negotiating team and encourage them to stop stalling and to negotiate with us in a respectful manner. Thank you.